Hi, I'm Dr. Dan Stein of the Stein Medical Institute in Tampa, Florida. For over 20 years, we've looked for safer, simpler, more effective cosmetic solutions. I'm delighted to tell you today about the Stein Instant Facelift and our new concept of skinectomy. These are concepts I think will revolutionize the next decade of cosmetic procedures. What exactly happens and what are these procedures? Well, let's look a little bit back over the chronology of time. Initially came collagen and facial fillers, which we used to plump lips, to give that beautiful smile, and to enhance natural beauty. Then came fillers that we could use for the cheeks and to take away from the hollow look under the cheeks, lift the eyebrows and lift the cheeks up. And they worked beautifully. And among them were Restylane, Perlane, Radius, and Sculptra. But nothing worked as well to prevent the ptosis or dropping that feather lifts did. And so in the mid to early 2000s, a Russian professor brought feather lift concept to America, and I was among the first 75 doctors in the country to do those procedures. They were simple barbed threads that would elevate the cheeks, reduce the nasolabial fold, and create a more youthful almond-like shape to the face. Feather lifts were great. However, as I've continued to follow people with both fillers and feather lifts, using all different types of feather sutures, I've noticed that the continuing problem, and perhaps worsening as they've continued to age, is loose skin. It's just a fact of life. As we get older, the skin gets thinner, the collagen under the skin gets thinner, and the elasticity that holds structures up gets weakened. And so we see dropping of the cheeks, dropping of the jowls, dropping of the neck with a turkey gobble, dropping of the chest, dropping of the abdomen, underarms, buttocks, hips, and inner thighs, even knees. And these can be quite unsightly. If you simply use techniques to fill or plump tissue, such as fillers, you can somewhat get a little bit of a lift, but really it's more appropriate for a younger woman in the 25 to 35 age group because it just won't get rid of extra skin, though it does fill the skin out. If you just use a feather lift, regardless of type, whether it's a feather suture, the original ones, or a silhouette thread or an endodyne band, the fact of the matter is all it does is lift, and it doesn't remove any extra skin. So as you look at your face and you're wondering what could be done to enhance your natural facial beauty without creating that wind-blown, artificial, fakey look, which is so important, I think, here, to enhance natural beauty, I think that you will realize that taking off the extra skin actually does that. And so this past fall, I had a very favorite patient of mine, a colleague as well, and we had planned for several months what type of procedure would be safest and simpler for her. She is a mature woman, and we wanted to take minimal risks. And so I invented the Stein Instant Facelift. Instant because the results are visible the moment you have it done when you walk out of the operating room. Instant because there's no bruising, minimal bleeding, no general anesthesia is required. It's all under local. It's participatory. We mark the patients with their participation in expectation of what we're getting. It works for both men and women, and the healing time is actually faster than a feather lift, even than a filler. She had her procedure on a Saturday morning. She went out that evening with a friend, and on Monday, 2 days later, she was back at work with no swelling, no bruising, no nothing, not even batting an eye, and minimal pain. So now we have a safe, simple, effective procedure to treat loose skin of the forehead, of the cheeks and jowls, of the neck, and just to remove the skin. Now, surely we have addressed the problem of tightening skin with non-surgical approaches. We've used creams, we've used hydroxyacetic acids, we've used peels, we've used photofacial treatment, we've used IPL, and Fraxel, which is a type of laser treatment. But nothing tightens the skin more than 1/16 of an inch or so. If you have a situation where from the bottom of your ear you can go out a 1/2 inch or more, there is no procedure other than removing the extra skin that will tighten your cheeks, tighten your jowls, and give you a more youthful look. And since it fits all of the Stein criteria of safety first, simplicity, efficacy, and less is more, we recommend this procedure today as the simplest, best procedure for facial enhancement, period. Now, talking about loose skin, we're not just talking about the face. If you think about it, whenever you get older, lots of times you put on weight where you don't want it, but we also are becoming very diet and exercise conscious. More and more people are having procedures or treatments to help them lose weight. And what happens? And I myself am a pioneer in Invasive liposuction, a technique where basically it's a safer, simpler technique to remove fat. Well, if you're removing the fat and not tightening the skin, the loose skin can form ripples or folds. And that happens in the breast as we get older, where you lose volume in the breast. It happens in the lips, where you get radial lip lines as your lips shrink. It happens, can happen in the underarm, where we've done procedures to tighten that billowing folds in the underarm. It can happen in the upper abdomen, under the breasts, and in the upper abdomen, above the belly button, in the lower abdomen, in the outer thighs, in the buttocks, and in the inner thighs. And we have developed safe, simple skinectomy procedures to treat all of those under local anesthesia. Now, the results are visible right away, but there is an incision, and that's different from basically the feather lift, where there isn't an incision. So what's the difference between a facelift and a skinectomy? Well, a skinectomy meets the Stein criteria of safety first, simplicity, and efficacy. A facelift is safe, but not as safe. It generally requires general anesthesia and may take 4 to 6 weeks to recover. It may result in distorted physical appearance of the face. The Stein lift is done under local anesthesia. While it takes 3 or 4 hours to do properly, all of the sutures are absorbable, no stitches are put through the skin, it's completely painless, and our patients look at their face when they walk out, and they've instantly changed their appearance by approximately 20 years. As we go to abdomens, the belly button really separates the upper abdomen from the lower abdomen. So we see rolls in the lower abdomen, and we see rolls also in the upper abdomen, particularly since so many of us are working at computers and sitting so much, where we tend to naturally roll up the upper abdomen. If you take fat out of a roll in the upper abdomen, you're going to have a looser roll. That is, there'll be less volume under the skin, and it'll be more likely to be more like a fold than a roll. We have addressed this problem with the upper abdomen lift and the lower abdomen lift. We've addressed the butt problem with the upper thigh lift and the inner thigh lift and the knee lift and the butt lift. So we've developed simple skinectomy lifts, like the Stein instant lift, for every part of the body. And they're all characterized by the Stein principles of safety, simplicity, and efficacy.